Getting help from social services programs usually requires participants to complete a series of tasks: filling out forms, attending meetings, and arranging travel and childcare for those meetings. But participants don't always complete these tasks. Why not? Through our research in the field of behavioral science, we've learned that human decision-making is rarely perfect. Seemingly small hassles can prevent us from reaching our goals, and actions don't always reflect intentions. For low-income Americans who rely on benefit programs, a missed appointment or a misplaced document can have severe consequences, sometimes including losing benefits. How can we help these participants complete tasks and obtain the services that programs have to offer? The Behavioral Interventions to Advance Self-Sufficiency Project, or BIAS for short, looked at how the design of programs and policies can better account for decisions that people make and how they make them.
The BIAS team is led by MDRC, a nonprofit social policy research organization, and sponsored by the Federal Office of Planning, Research, and Evaluation. BIAS designed and implemented interventions in 3 social services areas: child support, childcare, and work support.
Using rigorous research methods, BIAS conducted 15 randomized controlled trials in 7 states to test whether these interventions could help make social services programs more effective for the people they serve. The results were promising. We found a significant impact on at least one primary outcome in each site. Most impacts ranged from 2 to 4 percentage points, and in several cases were much larger. In Indiana, we found that mailing parents a simpler letter and a reminder increased attendance at a child care subsidy appointment. Helping low-income parents who are working or in school continue to receive child care without interruption of services. In Los Angeles, we found that sending new behaviorally informed materials increased the number of parents who engaged in a mandatory welfare to work program, which meant parents could avoid losing benefits. In Texas, our trial found that behaviorally informed interventions could increase the number of incarcerated parents who apply for modifications to the amount of child support they owe, which means less debt for incarcerated parents. And it didn't cost much. Across the board, these interventions were typically less than $4 per participant. The BIAS project showed that behavioral science tools can be used to deliver services more effectively and efficiently and improve the well-being of low-income children, adults, and families.